Welcome back to West Texas View.
Depression, bipolar, yeah.
Welcome back to the West Texas View. You've met Dr. Bobby Jane and Dr. Stephanie Caples, and they're here talking about not only psychiatry and psychology, but how they mesh together. And this time, this session, I want us to talk about how you do work together. Give us an example of a specific case, maybe bipolar or depression or something like that, where you would work together, to give us a picture.
Well, one of the cases, this is a case we probably shared it. This was in a female, an adult female who had a childbirth and was struggling with depression. She was so depressed that, and probably because of postpartum after childbirth, that she was having, depression was so severe to the point that she was having thoughts about hurting herself. So she came to me, and she came to Dr. Caples first, and Dr. Caples, knowing the gravity of the situation, thought that the best approach would be to continue with her counseling, but because there was a fairly life-threatening situation, we need to take some urgent steps and see if she needs hospitalization or if she needs medications. So that's where I got into the picture. That patient eventually ended up in the hospital because of suicidal thoughts. But when she came out of the hospital, I was instrumental in continuing her medications, monitoring her side effects, seeing her response to the medication. And because depression is not just responsive to medication, depression also gets responsive to how you take things, how you perceive things, what we call the cognitive aspect of depression. Give you an example. You walk by the street and you see a friend coming by at the other end of the street, and you say hi, and the other person ignores you or doesn't respond to you. You can have many thoughts of that at the time. One thought that the person is angry at me and I don't know what I did with that person, that's why he's ignoring my greeting. That'll make you apprehensive, anxious, maybe depressed a little bit. But at the same time, if you think that maybe he's occupied over something, maybe he has something going on in his life, maybe he didn't hear me, that will make you feel normal. It won't make you feel
completely different
viewpoint. So the situation is the same. How you perceive the situation, that's kind of half glass full, half glass empty, that kind of situation. That plays an important role how we perceive depression. And that's where Dr. Caples' expertise comes in. She specializes in making people realize and understand that there's not only a very pessimistic, depressive way of looking at things, but there are other explanations, or other ways you can handle situations. Definitely. And when I work with the medications, of course, medications do address what we call the biochemical aspect of depression, where these medications do help in readjusting the chemical milieu we have in the brains that facilitates a patient being more receptive to the kind of direction Dr. Caples comes in. So that's where Dr. Caples comes in, and you want to share?
Well, sure. I think the first thing that it's important for me to do when I first have a patient, and like the patient that Dr. Jane was talking about that we shared, is educate them on their condition. A lot of people will have an unclear idea of what maybe depression or bipolar disorder or whatever it is. And so
they use wrong terms, like, am I crazy?
Right, exactly. They use wrong terms, and they think depression is just simply sadness or crying, or it could be irritability, it could be lack of concentration, lack of sleep, appetite. There's so many different ways depression can manifest. So I help them understand what depression is, how depression is affecting them. Just because you and I are both depressed doesn't mean that we have the same symptoms. Very much like if we both had a cold, I might have different symptoms than you do. So I help them understand that. I also help them understand the behaviors that they are doing, possibly because of the depression, that are not helpful in their life, the ways that they're coping that are not very helpful in their life. And that also has to do with the thought process that Dr. Jane was talking about. Sometimes our thoughts will lead to our behaviors and so forth. So once we have identified the things that the people are doing that are not very helpful, the coping skills, we work to change those. And that helps with changing the thought process, like he was saying, the example of the person walking down the street. And we also work to actively change the behaviors to cope with the depression.
And so how do we know when they come to you, when you say, this needs more than just talking it out?
Right.
We need some medication. How do you know what their chemical? What kind of test do you do to know what their chemical imbalances are?
Well, actually, sadly, we are not at the stage of our advances in the sciences that we can detect depression by doing a blood test or doing an image of MRI or anything of the brain. How we detect and how we measure depression is by what we call rating scales. So we have a questionnaire, and the questionnaire asks specific questions regarding the mood, the behavior. They are tapped into aspects that are known to be affected when a person who has depression undergoes through that condition. So, and we ask those individuals to fill up those questionnaires, and depending on what's going on in their lives and how they perceive those questionnaires, it gives a very good reflection of whether they have depression or not. Depression at this point still is a clinical diagnosis. What it means is that talking with clinical assessment, talking to a physician who's trained to assess depression, like Dr. Caples and myself, that's the only way to detect depression right now. And as you said, depression is not something that's cookie cut or same all the time. Depressions are very different kinds, and everybody has different kind of depression. The symptom may be same. At the same time, the manifestation, the cause behind can be very different. And one thing I would say what Dr. Caples does very well is not only teaching, having the patient involved also, but also get the family involved.
Oh, good.
Where the support of the family is almost equally important. Be the spouse or parents or children there, because role of family in depression and mood problems
is affected and affects it.
Both ways.
Definitely.
It's both
Definitely.
ways. It's affected, as you very well put it, it affects and affects both. So it's a combination of both. And how we know at what point to refer to counseling, or what point to get medication. And that's where the clinical expertise comes in. You experience seeing the patients, you try medication first. Usually the kind of symptoms they present, some symptoms are more responsive to medication. For example, having problem with sleep. Now that probably is more responsive to giving medications, either antidepressants or some sleep aids. Agreed that as the depression gets better, sleep gets better too.
Exactly.
And so you may have to fine-tune this medicine because it's not a scientific study.
Absolutely.
We're going to come back next Sunday and continue this program because there's so much more we need to talk about. We'll see you next Sunday, and we appreciate Dr. Jane and Dr. Caples being here today.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.